Welcome back to Patriot Network TV. I want to do just a few more minutes with you today about the government takeover of healthcare. The U.S. federal government a year ago today attempted to take over the finest healthcare system in the world under the false umbrella of a series of statements about how they would bend the cost curve down. At the time, many of us were very upset that the vote was being forced through, being pushed through before the Congressional Budget Office could even score the cost of this government takeover of healthcare. And just to make this really clear, the essence of what the U.S. federal government behind the current president and the democratically controlled Congress wishes to do is take over about 1/6 to 1/5 of the U.S. economy and replace the best healthcare system on earth with a third-rate healthcare system like they have in Great Britain. Having grown up in Montana on the border with Canada, our hospital, the Little Deaconess Hospital in Great Falls, Montana, was always full of Canadians. And it was full of Canadians who had enough money to fly down to Great Falls, go to the hospital and get surgery, get medical care right on the spot. Now, if they wanted to stay up in Canada, they could wait 5 years, 6 years, 7 years, however long they had to wait for a procedure. But if they had the money, they could fly down and get it done right in the United States. This government takeover of healthcare doesn't do any of the things that President Obama and the democratically controlled Congress at the time said it would do. First among them was to bend the cost curve down. It comes out now, a year later, that the Congressional Budget Office is $2.3 trillion different than the president on what it'll cost. The president says that we have $7.2 trillion in spending over the next decade based on his suggestion, the government takeover of healthcare. The CBO says, no, it's not 7.2 trillion, it's 9.5 trillion. So that's a $2.3 trillion difference right there. That's not bending the cost curve down, that's shooting it through the ceiling. Now, keep in mind that when Hubert Humphrey, the happy warrior, went on the floor of the Senate and introduced the Medicare bill, he said, in 30 years, in 1995, we project that Medicare will cost $10 billion. In 1995, Medicare cost $120 billion. They were off by a factor of 12 to 1. So over the next decade, if they're off in a similar fashion, it won't be 2.3 trillion, it'll be 20 trillion. It'll bankrupt this country. Now, what is worst about the government takeover of healthcare is not this giant cost. If this giant cost would provide people with healthcare, I could almost grit my teeth and put up with it. But what we're going to do is get the worst of every world. We're going to pay more to get less service, less innovation, less medical care, and we're going to see a migration of doctors out of our healthcare system. Medicus recently did a survey of practicing physicians. 40% of them said that if this law goes fully into effect, if the U.S. Supreme Court doesn't strike it down as unconstitutional, 40% of current physicians will retire. They will leave the practice of medicine. Now, this law is aimed at getting 50 million people. That's the number they always used, 50 million uninsured. They want 50 million new patients. With 40% of the physicians leaving the practice of medicine and 50 million new patients coming in, how in the world do we get medical care anywhere near what we used to get? Every part of what was promised. You like your doctor, you can keep your doctor. It'll cost the same, you can have the same insurance. Every one of those promises is a lie. We need to repeal this law. We need to stop the government takeover of healthcare, and we need to establish the free market as the source of innovation and care in this country. We are the last best hope of the entire world for good medical care. Talk to you soon.